Welcome to The Bridge, Your Health, Your Voice, the official podcast for the University of Maryland, Baltimore School of Pharmacy Patients Program. The Patients Program is the bridge between the community and researchers. The Patients Program created this partnership to help researchers listen to the community's voice in order to build a bridge to an effective learning healthcare community. Here's your host, Rodney Elliott.
Dr. Jason Falvey, how are you doing today?
Hey, Rodney, great to be here. I'm doing great. I'm excited to chat with you about our ongoing research out there in West Baltimore.
Oh, my goodness. Yes. I remember last year around Patients Day, even before Patients Day started in October, I was outside meeting and greeting folks, and I think you walked by me, you said hello, exchanged pleasantries, and you said, Rodney, hey, look, I want to be a part of Patients Day soon, if not, next year. I put it in the back of my pocket, and sure enough, you will be participating in Patients Day this year. We'll talk about that a little bit later on in our conversation. But we're going to start our conversation talking about a project that is near and dear to you, to your team, and to the West Baltimore community. So, ladies and gentlemen, I'm Rodney Elliott, the Community Engagement Specialist for the Patients Program. Glad that you are tuned in wherever you're listening to this podcast. I'm talking to Dr. Jason Falvey, the Director of the Center for Disability Justice, whose research probed at the inequities of rehabilitation and how to improve rehab access and support, specifically for the West Baltimore area. So the Patients Program is proud and excited to assist you in your efforts, and we're going to dive right into it. Our first question, Dr. Falvey, can you provide an overview of the key findings from your research on inequities in rehabilitation access and the outcomes for people with disabilities?
Yeah, I think it's a really exciting project for our team to really think about community mobility. So that's the broad umbrella that we talk about all of our research in, is how do we get people out of their home and into the community and back to doing things that they love to do. And for many people that we've talked to in West Baltimore as part of our research or otherwise, that's visiting family or friends, that's being able to attend religious services or getting back to church, going to the store, being able to go out and do something fun, or maybe even getting on a plane and visiting a family member at the beach or in another state, which, I can definitely appreciate and would want to help people get back to those things. And the problem is that the opportunities to get out and around the community aren't equal depending on where you live in Baltimore. And I think our work really tries to figure out why people in certain neighborhoods have more challenges getting out and about after having a surgery or breaking a bone, and what we can do from a physical therapy standpoint, from a neighborhood standpoint, and from a community public policy standpoint to help improve the ability for someone to get out of their home and into the community to access healthcare and to do fun social things.
Dr. Falvey, I just recently took some time off and went away to Arizona with my wife and mother-in-law and father-in-law. And my father-in-law, he's not as spry as he used to be. So we traveled for the first time. I know I did, with the wheelchair, with the walker and everything. And it was a smooth process with the airline. Airport was great. My mother-in-law called me at least 2 times since we've been back and thanked me so much for being there to help them and assist them, because without myself and my wife going with them, they wouldn't be able to see their family in the West Coast. So to know that there's a group out there that is helping folks, like you said, get back to the fun or still be active in, their families' occasions, or like you said, just being able to travel comfortably is awesome. So, what are some of the most significant barriers that individuals with disabilities face when they're trying to access rehabilitation services?
Yeah, and I even think broader, just like what are the barriers to getting out to access any healthcare or do those things that we talked about? And so we frequently hear about the sidewalk quality, and I would say that's one of the most consistent things across the interviews we've done is broken and cracked sidewalks, or not having sidewalk cutouts, or having debris or ice or snow covering sidewalks and not cleared. Affects all of us to get around, but it disproportionately affects people who use wheelchairs or who use walkers or canes to get around, because it's harder to navigate,
Yeah.
And many of our patients that had a knee replacement, they're not able to jump up over a tree branch like I could, or hop up on a curb, right? I realize I have a lot of privilege in my growing slightly older legs, but I think those are common barriers we hear. And then even just using a device, people have told me that they feel like targets for potential, crime or violence, or that people that they would be targets for, opportune, robberies, and this is either real or perceived, fear that people have, either they've experienced it personally or had a family member. But those are barriers that disproportionately impact people that use assistive devices to walk. So the social makeup of a neighborhood and how much the neighborhood's able to come together. Some do a great job and really protect people in those circumstances and create a community of support. And some neighborhoods just don't have those resources or finances to be able to support those kinds of programs or those kinds of organized activities for somebody who really wants to get around. So those are the two major things that have come up in our research. And transportation, I bet, is another one. There's, even if you can walk a couple blocks and get to the bus stop, the buses and trains are not well set up for people who need to get on them with wheelchairs or walkers. And sometimes the lifts don't work. Sometimes a driver may not be comfortable with strapping down a wheelchair, or may take off quickly, and a person with limited balance may have difficulty or fear standing up or staying standing on a bus that is very crowded. And these are real fears that our patients are telling us about.
Sounds like you got some really, really authentic information from the community already, and I'm excited to see where this project goes. But when you talk about safety, when you talk about whether it's safety getting out in your neighborhood, or whether it's safety you traveling using public transportation, I can imagine how that can maybe prohibit folks from wanting to, again, go outside and be involved. So when we talk about strategies or policy changes or how that can be improved, what specific strategies or policy changes do you recommend in improving access to and the quality of rehabilitation services for marginalized communities, for communities that don't necessarily have a voice, or for communities that don't necessarily have the resources to navigate post-injury, post-trauma?
Yeah. So we kind of have a 3-bucket intervention or a treatment pathway that we are going to test out. And we're going to put that together and be getting some input from members of the West Baltimore community. So if you're in that community and you're listening to this, maybe reaching out and asking for your help and giving some input into how to develop this. But what we think is we need some rehabilitation services that directly go into the community and help meet the challenges in the neighborhoods or the homes where people live. So walking in a clinic or doing exercises in a clinic will get you stronger, but it might not help you get around the broken and cracked sidewalks that are specific to your neighborhood. Or you might need somebody to walk with you and get some strategies on how to do that a little bit more comfortably or confidently. We also want to partner with resources like Maryland state government has durable medical equipment, which are the walkers and the canes and things that people often need to walk, and can provide them free of charge. So could we get equipment to people that allows them to walk easily in the community at no cost?
Yeah.
Could we hook somebody up with a walking buddy? Is that somebody that lives in the community, or somebody who is, a little bit more comfortable walking in that neighborhood? And could those people walk together to feel a little safer? And then what can we do with public transportation to help people be able to access it better? And the unfortunate thing is people in West Baltimore are more likely to rely on public transportation to get around, but the access quality of that service is worse in those areas. There's less density of stops. Even the quality of the stops, where is there shelter? Is there somewhere for somebody to sit where the bus is coming? For you and me, it's an inconvenience to stand, but for somebody who really has fatigue or a new knee injury with a lot of pain, it might be an impossibility to stand for 20 minutes waiting for a bus. And even paratransit or mobility link, it's 2 hours on either side of an appointment. It just makes it so difficult. It's a great service, but it's very inefficient for people and makes it so you really have to prioritize must-do medical care versus fun social things that are important for our health.
Yeah. I've heard those stories from folks, older adults who I've engaged with, that you're right, they can't or don't have the opportunity to travel to a doctor's appointment or to an event because they can't rely on reliable transportation. And these are folks who, don't necessarily need assistance or haven't had any trauma or aren't in a rehabilitation process. But I can only imagine for folks that do carry that burden, that it's even more challenging. So the suggestions or the idea that you mentioned, Dr. Falvey, they kind of seem like common sense. They kind of seem like, hey, why won't someone just assist or assign someone to walk with someone? Why won't the community recognize when they get a couple phone calls saying that on the corner of XYZ, the curb is cracked? How come that's not priority for, Baltimore City or who's ever responsible for fixing those? So my next question goes to, how can healthcare providers and rehabilitation professionals better address and mitigate the disparities that are identified in your research? Because you've identified some quality stuff.
Yeah. So my background, I was a home-based physical therapist for a long time and across, rural areas of Wyoming and in Denver, in the middle of the city of Denver, when I was practicing full-time as a clinician or working clinically as part of research. And, I think the first thing is you don't know what you don't measure. So if you don't ask people about these barriers, you're never going to start being able to come up with solutions as a healthcare provider. And rarely do we ask people how they do getting around in the community to visit their family and friends or about their social connections. We ask them about their blood sugar and their blood pressure. We might ask about pain, and we might ask about function if the doctors are really, holistic and whole health focused. But rarely are we asking about community mobility, social connections, loneliness, those kinds of things where getting out in the community more and bridging those gaps, it might lend some urgency if we just ask patients about those things. So you got to measure it. And then clinicians really have to have good partnerships with the community and know where the resources are, not send them to a website or something that may or may not be outdated, but send them to a person that knows the community well, or send them to a community health worker or a social worker who's intimately familiar with what resources are available and will follow up. It's so disheartening when patients are like, oh, they asked me about all these things, but they never followed up. So it's harmful as healthcare providers if we ask people and then we don't follow up on the things they tell us they need. So those are both important steps. Measure what we need to measure and then hand people off or collaborate with the community to make sure that you connect the dots and don't leave people with unmet needs.
Yeah, that's great, Dr. Falvey. That's fantastic. I think some of the things that you're talking about have the possibility of really, really coming to fruition and helping some folks in West Baltimore and hopefully beyond West Baltimore, because I know this is not specifically just a West Baltimore problem or issue, I should say. And kudos to you and your team for addressing it. Kudos for you and your team for going out in the community to find folks who are willing to talk about it and share their opinion. I think the Patients Program pride themselves on having an opportunity for folks to have a seat at the table when it comes to their health care. And this is something that's a little bit different. Again, it's not about measuring, blood pressure or measuring issues of that nature, but it's about getting back to who you were or, being a contributor to society, whether it's, going to a health event. Like one person in particular I'm thinking of, Dr. Falvey, and I will share that person with you later on offline. She loves going out down to the Inner Harbor and just walking around, or even she mentioned to me that she just loves still going there, taking some bread and just feeding the birds down the Inner Harbor, right? That's one of her things she loved to do as a pastime. My grandma used to do that. But depending on how she's feeling, depending on how well she slept the night before, depending on, what the weather is, that may deter her from taking public transportation and going down there. So, this is great because it addresses some of the needs that helps folks mentally, helps them physically, financially, and socially. So it addresses all those issues. Dr. Falvey, before we get out of here, like I started off our conversation, we talked about last year Patients Day in October, and you mentioned that you wanted to work with the Patients Program. You wanted to participate in the Patients Program, and I didn't forget that. I actually wrote a note to myself in our debrief from last year saying, hey, call Dr. Falvey, reach out to Dr. Falvey, talk to Dr. Muller and see if this can make sense for Patients Day 2024. So that is true this year. You and your team will be presenting at Patients Day 2024. Patients Day this year, guys, for our listeners, is Saturday, September 21st. It's a free event. It's from 11 o'clock to 3 o'clock at the Community Engagement Center in West Baltimore, which is on 16 South Poppleton Street. You'll find information on Patients Day in the write-up for this podcast. Dr. Falvey, can you talk to us a little bit about what the participants who are going to attend Patients Day this year, what can they expect to learn from your presentation and talking about how to help them rehabilitate post-trauma out in the community again?
And so we're going to bring some of these ideas that we've talked about here. We're going to bring this to the group and really share some additional findings from what we've learned from the West Baltimore community, some of the themes, the major themes that have come out of these interviews, and really say, how can we now better address this? We have a framework that we proposed, but we don't live in those communities, right? I live in Ridgely's Delight, right on the edge of Pigtown, but I don't know some of the specific barriers that specific people have in neighborhoods, and I don't know what is already being successfully implemented. Maybe people are way ahead of me, and they have a great idea that I can help as a researcher fund or further support or test. So I'm really excited to be able to share those findings, but I'm really actually more excited to learn from the community about what am I missing, or what other things have I not thought about that we can really use to better the health of the community. So that's the co-development piece, and I'm really excited to hear that and be able to share with the PhD student I'm mentoring, who's also very interested in this area, and physical therapy students who are learning the importance of community engagement and communication with patients as part of their participation in the health fair later that day.
I like that a whole lot. I'm excited about it. And even in our conversations prior to this interview or prior to this podcast, we talked about what that's going to look like. So folks that are listening, remember, you can come out to Patients Day and hear from Dr. Falvey and his team about some of the findings they have up until this point. But just as important, you can actually contribute to Dr. Falvey's work by providing suggestions to him, by sharing what works in your community, what don't work. And then who knows, later on down the line, I'm pretty sure Dr. Falvey can reach out to folks and help collaborate and get this information into the hands of folks who can change things, who can adjust things, policy changes, because your lived experiences help shape Dr. Falvey's research. Kudos to you and your team to participate in Patients Day this year by coming in and presenting to our group, looking for opportunities to collaborate. And then more importantly, you actually have a opportunity for folks to kind of get a small assessment on where they stand when it comes to mobility and post-trauma education, I would say, so to speak. Can you speak to a little bit about that, like what that looks like for folks who want to kind of test and see where they are?
Yeah, and so the nice thing is the assessment we're going to do is kind of for everybody. Like if you had a knee replacement, or you had an injury in the past, or you just want to see where you are and write down those numbers and be able to compare next year to make sure you're moving just as well. So what we're going to do is educate about fall risk, and we're going to do a quick test to look at your ability to walk and turn and sit and stand out of a chair. It gives us a good quick assessment of your leg strength, your walking speed, and your balance and coordination. And from those assessments and how long it takes, we can make some recommendations on, activities you might be able to do at home to reduce your likelihood of falling. Because as much as I love having patients in my trial, I love even more patients being healthy and not having falls and having to come do research with me. So I like all of you, but I don't want to see you in my research trial unless it's absolutely necessary. So we want to keep you on your feet, and that's the exciting part that we're hopefully going to bring with me and hopefully some students that are going to come along.
I love it. I love it. I love it. Data. For those of you listening, Dr. Falvey loves data. So come out to Patients Day this year, 2024. Again, it's going to be September 21st. It's on a Saturday. It's a free event. We're going to have free food. Dr. Falvey is going to participate with his team. We'll have another researcher there as well, and we're going to have health resources for the community. Dr. Falvey, I can't thank you enough for carving out some time in your busy schedule to talk to me here on the bridge. Much appreciated, and I look forward to seeing you at Patients Day 2024.
Excited for it. Looking forward to it.
Thank you for listening to The Bridge, your health, your voice. To learn more about the Patients Program, visit our website at www.patients.umaryland.edu.
Dr. Falvey, can you provide an overview of the key findings from your research on inequities in rehabilitation access?
The opportunities to get out and around the community aren't equal depending on where you live in Baltimore. And I think our work really tries to figure out why people in certain neighborhoods have more challenges getting out and about after having a surgery or breaking a bone, and what we can do from a physical therapy standpoint, from a neighborhood standpoint, and from a community public policy standpoint to help improve the ability for someone to get out of their home and into the community to access healthcare and to do fun social things.